Okay.
Hi, I'm Stephanie. I'm going to be your student nurse today. I'm going to wash my hands. Do you have any allergies?
No.
Alright, can you give me your name and birthday, please?
Kaylee Mills, 5/16/90.
Alright, are you in any pain today?
No, I'm not.
Alright, patient looks stated age of 24. She's well groomed, she looks clean. No detectable body odor or breath odor. Mood is pleasant, speech is clear and controlled, and affect matches mood. Do you know where we are?
We're in White Lake.
Do you know what today's date is?
Yes. February 12th.
Patient is oriented +2 to place and person. And so the first thing I am going to do is I'm going to start at the head. Alright. Skin is warm and dry. Temperature is equal bilaterally. She has freckles but no nevi or lesions. Okay, can you smile for me? Close your eyes. Raise your eyebrows. Puff out your cheeks. Alright. Facial expressions are symmetrical, which indicates that cranial nerve 7 is intact. And now I'm going to have you clench your jaw. I'm going to palpate the masseter muscle and the temporal muscle. Are both equal and strong. And now I'm going to have you close your eyes and tell me when you feel my touch.
No. 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 No.
Alright, motor and sensory, the parts of cranial nerve 5 are both intact. Now I'm going to look at the eyes. Pupils are round and symmetrical, about 4 millimeters in diameter. Now I'm going to test for pupillary light reflex. Alright, I'm going to have you look kind of over my shoulder. Alright, pupils constrict, and there's also consensual constriction. And come in one more time. Alright, pupils constrict, and there's also consensual constriction. I'm going to have you look right here at the top of my pen. Alright, eyes accommodate, and there is constriction of the pupils. Now I am going to look at the mouth. Oops. Alright, can you open your mouth for me, please? Alright, oral mucosa is pink. No lesions or bleeding. Smile for me. Gums are pink. No lesions or bleeding or retraction. Teeth are white and straight. Can you stick out your tongue for me? Alright, say ah.
Ah.
Uvula is midline and lifts when the patient says ah, and the tonsils are a +1. Now I'm going to go to the neck. I'm going to palpate the carotid pulses one at a time. And they are +2 and equal bilaterally. And then I'm going to listen for bruit using my bell. Alright. Alright, and I'm going to have you hold your breath for me. And let it go. And then again, one more time. Alright, no bruit present. And then I'm going to go to the upper extremity. Check for temperature is warm, skin is dry. I'm going to palpate the, I'm going to sit your hands up here. I'm going to palpate the brachial pulses. They are +2 and equal bilaterally. And then I'm going to palpate the radial pulses, which are also +2 and equal bilaterally. And then there's no lesions or sores on the arms. I look, there is a little bit of dryness, which is not weird for the winter. No bruises or anything like that. And I'm going to look at the fingernails. Capillary refill. Color returns in 3 seconds. There's no clapping of the fingernails. And then I'm going to have you squeeze my fingers, please. Alright, so the hand grip is strong and equal in both hands. And then I'm going to go to the chest, start with the heart. I'm going to first listen with my diaphragm, starting in the second intercostal space at the aortic location. Alright, so palpate first. I'm going to go to the pulmonic in the second intercostal space on the left. And then I'm going to go to the herbs place in the third intercostal space. And then I'm going to go to the tricuspid space in the fourth intercostal space. And then I'm going to go to the mitral place in the fifth intercostal space at the midclavicular line. And then at the mitral space is where I would listen to the apical pulse for a minute. And then I'm going to flip my stethoscope back to the belt, and I'm going to listen at all 5 locations on the way back up for heart murmurs and regular S1, S2 sounds. So flip, at the mitral, the tricuspid, the herbs, the pulmonic, and the aortic. Then I'm going to go back to my diaphragm, and I'm going to listen to the lung sounds. I'm going to start at the apex. All right, can you take a deep breath for me? And then I'm going to go over to the other side. And then breathe again. Yeah. So I would go across 10 sites across the chest, going down and across. So then I would listen all the way down, and then I'm going to listen laterally also, so I'm going to have you lift your arm, and then take a deep breath. And then again on the other side. And then we'll listen to 10 sites on the back. Alright, have you take a deep breath. There you go. So now we continue. 6 sides down the back, or 10 sides down the back, and then so there's no presence of adventitious sounds. Her breathing sounds like a regular whooshing sound, no crackles or wheezing. And then I'm going to percuss the costovertebral angle for tenderness. Any tenderness? And then I'm going to have you bend forward for me. Then I'm going to assess the spine. There's no curvature of the spine. It's in alignment, no kyphosis or lordosis. And then I'm going to look at her anteroposterior diameter. So it is 1 to 2 approximately. And now I'm going to look at the lower extremities. Oh, first I'm going to look at the abdomen. Lay down for me. Alright, I'm going to have you lift your shirt. And the first thing I'm going to do is inspect. The skin is even. Color is appropriate for ethnicity. There are no scars or lesions or any other skin breaks. She has a belly button piercing. So after that, I'm going to, on the abdomen, you're going to inspect, auscultate, percuss, and then palpate. So the next thing I'm going to do is auscultate, starting in the right lower quadrant. Bell sounds are heard in all 4 quadrants. Patient also has a tattoo on her right side on the ribs. The next thing I'm going to do is percuss, looking for the sounds dullness over organs. So I'm going to start in the right lower quadrant. So we hear tympany here. Dullness in the right upper quadrant because of the liver. Tympany in the left upper quadrant. And tympany in the left lower quadrant. So the next thing I'm going to do is palpate, starting in the right lower quadrant. So in light palpation, in the right lower quadrant, we'll have the appendix, the right ovary, and the right ureter. In the right upper quadrant, we'll have the liver, the gallbladder, the right kidney, the head of the pancreas, and the ascending and transverse colon. In the left upper quadrant, we'll have the stomach, the spleen, the transverse and descending colon, and the body of the pancreas and the left lobe of the liver. Are you feeling any tenderness? And then in the left lower quadrant, we have the left ureter, the left ovary, and the sigmoid colon. And the left upper quadrant also have the left kidney. So now I'm going to help you sit up, and I'm going to look for jugular vein distension. When she gets 45 degrees, it should disappear. And the jugular vein does disappear, so she does not have jugular vein distension. Now I'm going to look at the lower extremities. No, I didn't look. Okay, now I'm looking at the lower extremities. Look at the skin. Skin color is even. There's no lesions, skin breaks, or there's a small bruise on the left knee. Are you feeling any pain in that today? I'm going to check the temperature. Skin is warm and dry. I'm going to, can I have you switch forward a little bit? I'm going to palpate the popliteal artery. Pulses are +2 and equal bilaterally. I'm going to continue down to the tibial artery. You relax your foot. So +2 and equal bilaterally. Down at the ankles, I'm going to check for edema. There's no signs of edema. And then I'm going to check the dorsalis pedis. Which was +2 and equal bilaterally. Patient also has a scar on the right foot and a tattoo on the inside of the left foot. Next, I'm going to do the Rubinsky test. I'm going to run the tongue depressor of the foot. So that would be a negative Rubinsky test. Now I'm going to have you stand up and walk to the door. Alright, patient's gait is effortless, controlled, arm swing opposite of the legs, no foot dragging or dropping. Alright, now we're going to perform the Romberg test and have you close your eyes, keep with your hands at your sides, and we do this for 20 seconds to look for swaying or any other loss of balance. So, it's a negative Romberg test.